unbelievable. Thank God it was a bariatric commode, because if it was a standard size one, like it would have, I'm telling you, I think it might have actually filled it all the way up. I'm serious. Never seen anything like it.
Yeah, you didn't forget about it.
And I never will forget about it. On my deathbed. And that elephant shit.
You are listening to NSR, National Scrubs Radio, where nurses, doctors, students, and other healthcare professionals bring you stories from scrubs across the nation. Tune in today with NSR's Derek J.
So welcome to NSR, that's National Scrubs Radio. This is your host, Derek J. I have a lovely guest today. Her name is Lindsay. She is a clinical nurse educator, and I made the mistake of calling her a nurse educator, and she quickly corrected me, and she'll tell you why. And in this episode, Lindsay goes over about her original career path that did not pan out. She also goes over her time in transplant nursing, some of the ethical issues that are dealt in the organ transplant department. Also, about the time of her life where her mom went through primary biliary cirrhosis. Last but not least, we talk about shit, and literally. And you'll hear Lindsay talk about one, I guess you want to call it shit episode, that almost made her leave nursing. That will kind of leave you surprised. Here's Lindsay. So welcome to NSR. This is National Scrubs Radio. I have a lovely guest today. Her name is Lindsay.
She is so lovely. Hi.
Hey, welcome to the show. I'm excited to have you here because I spoke with you recently, and you kind of corrected me when I told you what like your title was. I believe it's a clinical nurse educator. Clinical nurse educator. And why is that so important that clinical is in front of that title?
For me, and I would say for the folks that I work with, it's because we still feel connected to practice.
Right.
I would say for the majority of us, we miss it. I miss it. And so nurse education for me, in the few places that I've worked, was very much folks that had left practice by choice and didn't necessarily need or feel the need to return, or had that was not in the cards for them. And for me, that's always been my backup plan. Or my plan, depending on where I'm at each day.
So would you say that the core part of clinical research is that clinical part? Like you need people that have done bedside or still work bedside to be part of research?
Yeah. So this is something we talk about a lot in our department because we have a research arm that's, I would say, I can't compare it to other institutions, but we have a pretty passionate research arm. And our director, who has a PhD and has done bedside research, she did research with Patricia Benner about nursing narratives, like who they are as nurses and how that speaks to their level of practice, expert, beginner, etc. And she was just like, what we did was we went to bedside. We watched nurses in practice. We talked to nurses after their shifts. And she says that like when she's in the schools, people are like, oh, I need a project. I'm a PhD and I need something to do. And she's like, go to bedside.
Right.
Go see what they're doing at bedside.
Get your hands dirty.
Get your hands dirty.
I put some gloves on, but you know
exactly,
what I mean.
Exactly. And so it's, I don't know. That's something that kind of makes me feel nerdy as a nurse, is trying to find ways to support people that want to explore practice where it's given, as opposed to exploring it either from the point of view of student nurses or from the point of view of data sets.
Right. But a lot of people want to hear nursing theory. They go, it's like an instant, right? Like I don't want to hear. So how do you educate nurses or the clinical side, or research, I guess, without making nurses, because a lot of times the nurses are taking care of patients, and like, I just took care of this really sick patient yesterday. I don't care about this. I have to come to a class or do this. Like, how do you make it fun for them, or where it's enjoyable, where they're not snoring, I guess?
I think part of it is exploring what made it meaningful and interesting to me, because I can get as bored as the next nurse, and I can get as distracted or frustrated by stuff that I'm like, why? Not right now. I don't have the time for this. And so for the Benner model, which I'd heard in nursing school, along with all of the other ones, I passed the test related to it, and then it was gone.
Right.
And then when I came to the Institute for Nursing Excellence where I work, or when I came into the department where I work right now, what we did was we read her books, which sounds terribly boring. But in the first chapter, you're just hit by these awesome narratives of nurses who were flight nurses, who were OR nurses, who were pediatric, cardiac, like
from
nurses
all backgrounds
everywhere, telling you about their patient care experience, like what they saw and did and why they did.
Right.
And then what followed that was the theory, which is so you can see here, here, and here that this nurse is an expert because this, and this. But it was all based on their stories. And that's something that I read it. I understood it.
Right.
I felt it. I felt that interaction with the family. I felt that fear of getting the crike wrong when you're on a flight team.
Yeah.
And so what I drew from reading that is what I try to bring out when I try to teach this theory to nurses. Because I would say that our institution, Benner's model, is our model of how you become an expert nurse.
And also, I think there's like a psychology of why people get into nursing. Like,
Yes.
certain types of medicine, because I've worked on a 1,000-bed hospital, and I had a fortunate position where I worked every floor every night. So I got to see, like, even from the burn
Everything.
unit to
Yeah.
Trauma 1 Center, and I got to see the different personalities that kind of were, led into those departments. Briefly, you were saying something about how you can tell, or there was a model or something, Patricia
Yeah. So basically
Benner?
what the theory is that we are expert, we are budding experts, they call it proficient. We are competent, which is 95% of nurses. Just like that bell curve that we all heard about and maybe hated. Experts are
I think
on one
most
end.
people might hate it, but
right?
yeah.
It's all right.
Yeah.
And then we have advanced beginners, which are your new grads.
Okay.
And then novices, which are your students.
Got it.
And so behind each of those terms I've just used are hundreds of narratives of nurses who described their practice, described their thinking, described what they saw when they walked into a room.
Yeah.
And what Benner and her research assistants, which included my director at one point, they pulled from that and just, I'm going to try to avoid getting too heady, but in qualitative research, it's all about words. And so what you can do when you hear this person's story and this person's stories, you compare across looking for themes and how they approach the problem.
Right? Yeah.
And so if person A and person B walked in a room and saw the problem without even touching the patient, that could be an expert nurse. Where if person C and D, maybe they're your new grads, walked in and started worrying about whether they were respirating. Right. Like that one thing. Like if you've watched a new grad, they're like, oh, the alarm is beeping. And it's like, but what else is happening?
Yeah, exactly.
And so that's boiled all the way down. An expert nurse is like in the Matrix.
So
They
where
walk in
do
and
you
they see it all.
fit in this model? Like, how did you get into nursing? I want to hear the story.
Oh,
Lindsay.
how I got into nursing. So I would say I left the floor as a budding expert.
Okay.
I feel as an educator that I am competent, scratching my way towards budding expert.
Okay.
I came to nursing by mistake. I wanted to be a forensic pathologist growing up. I was
Forensic
really
pathologist.
super big fan of Patricia Cornwell and her totally grotesque novels.
I have no idea who that
So
is.
it's
Is it the same thing like the people that do like the autopsies and stuff, like
Yeah.
in Orlando?
Yeah.
And it's like for a
Totally.
crime scene. Okay.
Yeah, I
All
wanted
right.
to weigh organs and like have dead bodies speak to me about what happened to them.
Okay.
Like that's the poetry of the forensic
Right.
pathologist.
Okay.
Funny story is my college roommate who was in the sciences but not a nurse, I fell asleep listening to one of those books on tape, and she
Okay.
walked in the room during like an intense autopsy narrative in the book, and she just was like, stop. And then she woke me up and she's like, are you okay? Because she thought maybe something was very wrong with
Right.
our situation. It was a little too early in our roommate situation for her
Gotcha.
to be hearing all that.
So she did not understand.
She was like,
whatsoever.
who am I living with? And I was like, no. It's a book on tape.
She probably slept with her eyes open, you know,
Oh,
like this girl is
yeah.
going to murder me right there.
So
Yeah.
luckily I was able to clear the air and show her that there was like, it's actually a book on
Yeah.
tape and not just
Yeah.
me being totally
It's not
scary.
my plot. Yeah.
I'm not
yeah.
trying to get her to move out. And then I had a hard time staying awake in calculus classes and other classes that you need for pre-med. And I just thought it was because like I was just tired.
Have you ever witnessed an autopsy?
No.
I have.
Like live? I don't think so.
Yeah,
Which is funny. You
It's
think I
pretty
remember.
gnarly. I tell you what, like you can detach yourself. You're watching the body, like you know, being cut up and stuff, and they literally peel like the rib cage. And I don't know the exact medical terminology for all this, so you know, forgive me, but like they pull the ribs back, and they're literally like taking the intestines out, like, as a whole.
I've watched a lot of fake ones.
And then they take like the from the trach or like the lungs and the heart and everything all in one piece.
They weigh them.
And then the part that got me right.
Stomach contents?
No. It was really cool because the patient had diverticulitis, so I got to see all the pathology of it and stuff inside, like visually. It's amazing.
Love it.
Yeah,
I would have loved it.
Yeah, and they had like polycystic, anyways. There's a lot of other stuff. I don't want to get too much into it, but the part that got into me is when they started cutting the head. Okay, and they took the skull off. I'm like, okay,
Woohoo!
there's like Hannibal, whatever. There's the brain, what. they peeled the face down.
Mm-hmm.
Like it's like almost like demasking a person. And for some reason that hit the part of my brain where I'm like, this was a person. You know what I mean? Like facial recognition just went out the window.
Mm-hmm.
And now it's like, whoa, this is real. Like they're doing an autopsy right now, you know?
Yeah. No, I would have totally loved it.
Yeah.
So, because I couldn't stay awake, I realized, and my GPA was starting to suffer, I realized I had to come up with a plan B.
Yeah.
And I didn't really have one. And so I had thought nursing would be easier and applied to get into the nursing program.
Right.
And then long story short, they handed me my ass on a platter. Like I just was completely humbled. And it was an excellent program. Like
nursing
UConn
school
was a
is
great
a lot
school.
harder than what people think.
Oh man. It was and I was working almost full time. Like I was just totally nailing myself to a wall the entire what turned out to be 5 years while I was there.
So I like what made you decide to go into that realm of like medicine? Like you were originally wanting to become a was it
forensic pathologist?
Forensic pathologist.
Yeah.
Okay. So what made you like, I want to do this? Like what was that spark?
I had that stereotypical grandfather who was a doctor thing, and so it just seemed like, and it, and I had parents that cared about having a kid that was a lawyer or a doctor. Like my mother, I wanted to make my mother happy.
Okay. So it's a whole typical thing. Like I got to do what my parents want.
And it was an easy flag to raise. I don't know what they like to hitch myself onto.
Yeah.
Because of saying that, like people have hope. And if you're moving in that direction, you're moving in a good direction.
Right.
And so that's sort of why I started in that realm. I think because it was so, and then the forensic pathology was because I loved the books and I was fascinated by all of the grotesque stuff that was happening.
And these are novels that you read? And that's okay. And that sparked the influence. Like that.
Totally.
Got it.
And then the idea of criminal justice and solving crime. So I actually continued, even though I went to nursing school, I continued and finished a criminal justice degree because I still really felt interested in that. I'd wanted to be a sexual assault nurse examiner for a while after nursing school. Like I wanted to be a forensic nurse, whatever the hell that meant in the late 90s.
I mean,
early aughts.
Those are all kind of like hardcore categories.
Yeah.
I'm not sure if hardcore is the right term, but like it's not like
They're
what
hardcore.
everyone necessarily goes towards.
They're not. You don't get to hug kids
right.
often. Like it's certainly not pediatrics.
Yeah.
Yeah.
That's really tough. Mm-hmm. So how long were you a bedside nurse before becoming a clinical nurse educator?
Almost 10 years.
Yeah.
Yeah.
And what made you decide to go into the clinical research?
Education was my dream job after starting at my current hospital was to be like a transplant CNS because I love solid organ transplant. And I figured that education was a good place for me to grow in a place that I hadn't grown. I'd done a lot of leadership work. I'd done a lot of practice-based, like translation of practice-based work, but I hadn't really organized my thought and developed content to educate people.
Let me tell you something about transplant. This is the only thing I know about transplant. Okay. Phlebotomy needs some overtime pay. Let me tell you, because the amount of blood that they draw, like on the transplant floor that I work, I was like, oh my, are you kidding me? Mm-hmm. It's like, it's a ton.
And they're really hard sticks.
Yeah.
I mean, there's really hard sticks throughout the hospital, but I'll just say that the phlebotomists lived on my floor for a long time and they hung out and they loved when we called them. We're like, we can't get it. And they were like, I got it.
Are you able to tell me a few things about transplant floor that maybe I don't know, or the common nurse or a common healthcare professional?
Every nurse has like I would say, or most nurses have their place where they feel the most comfortable or the most engaged. And for me, transplant, like the ethics of it, the complexity of it, the fact that people like to die at the drop of a hat, like and exsanguinate, the fact that it's like dirty,
right?
Like dirty downhill slides, and then we get to take people and send them home alive. So I get the mixture of
it's like a rebirth.
It's crazy. So I get to see people at end of life and be both palliative as well as just supportive of their death process. I get to see people saved that didn't think it would ever happen.
Right.
I get to be a surgical nurse and tell people to get their ass out of bed. Like, we're getting up right now.
Right.
Stop, no whining. And then in the next room, like hold someone's hand and just be supportive of them as they deal with the fact that like some random needle stick, like, or some random vent accident. There was an RT I took care of once that had gotten blood from a vent blowing up, and he had hepatitis C, and he was here in liver failure. Like, being able to be all of those nurses in one place, like my nurse ADD was set, my
it can be stimulated, like, you know what I mean? Because I feel
Totally.
like, because, you know, general med search sometimes, and not to generalize or stereotype, but I feel like people that need high stimulation, they get too bored on certain units.
Yeah.
You know, that's how I am.
That one kept me, I never left, I never got bored. I left because I professionally had other things I wanted to do.
Right.
Like, and when I'd learned from a mentor, like if a door opens, you really, really should think about walking through it. And if you don't walk through it, just understand that might be your last door. And it sounds very severe. And it's actually, in a way, been true. Like I've been offered opportunities since I started my current job as an educator that are great, that are huge growth opportunities. And I've just been like, no, like sometimes you walk through enough doors that you're like, I think I need a break. And so the education was a door that I had to walk through, but I like transplant still nerds me out. Like I would still want to be a transplant CNS.
So where are some of the ethical issues on the transplant floor?
There's always the story, and I think anyone that works in transplant knows that there's the story of the person who probably shouldn't have gotten a transplant. Whether the team had any inkling of it or not, you'll always find out after the fact. So the person whose family members actually aren't capable of managing their needs, the person who is actually kind of a psychotic human and is not going to allow anyone to take care of them, even though they need it after transplant.
So what happens? I mean, I don't know.
Usually those organs fail, and that sucks. Sometimes we're able to marshal the resources needed to keep things going, but in 10 years of doing that, and the 2 or 3 people that come to mind as I talk about it, one failed because it was precarious to start with, and the other one failed because I think the person actually inherently had a big fat evil streak.
Right.
And things don't usually work out really well when you don't take care of yourself and you don't.
I didn't realize karma was part of the transplant.
It is in my mind. For me, it is. I think it really can be. If you're not appreciative of the gift of life, you are a toxic person,
right? And
your body's not you can't.
There's definitely an emotional part that goes into medicine, right? And the physical part, right? I mean, there's definitely a connection between two. So sometimes karma's a bitch. And the problem is that some other people who are just unlucky, unfortunate, there might be the nicest person, but they have this and that's tough too.
That's hard.
To me,
we've got a lot of those where you're
how
just
do you cope with that?
That's the $1 million question.
Yeah, I could just see the hamster spinning the wheel right now.
Yeah, because we've had a couple of patients who've been with us for long periods of time, and some of them, the clinicians, the entire team needed breaks from them because they either personality-wise were a heavy load or they sickness-wise were a heavy load. They were just too precarious or just too nervous for us to handle day by day. And so that concept of primary nursing, where you have the set of people that will always be there,
right,
and then you're just cycling through them, where somebody's like, I need a break today, so I can be there tomorrow. I need a break this week so I can be there next week. But then when I think of how things turned out for some of those cases, people get excited and come to the nurse's station whenever one of those patients comes to visit, because we just can't believe how they look. We can't believe they're alive, that they're taking care of themselves, that they're following all of the things we begged them to do so that their transplant would go well.
Yeah.
That's just the coolest thing.
Especially the people that don't take it for granted. You know what I mean?
Yeah.
That's man, this person had this second chance. And they took full advantage of that organ.
There are so few that take it for granted that they're not even, they're worth mentioning in this conversation, but as a transplant nurse, they just don't bear much weight on my nursing soul.
Right.
They're you can spot them from a mile away.
And what part does depression play in that? Because I feel if you're going through all these major life events, that sometimes they could be just depressed, or I don't know if there's that emotional side with having an organ transplant as well.
I think one of the places where we don't serve our patients amazingly is in the post-transplant process. I think one of the things that a lot, it's not just transplant, but transplant is very much chronic illness to chronic wellness.
Right.
And one of the things that I've always taught my patients and their family members was you're used to answering the call every day and solving the problems and saving your family member's life. You're still going to be needed to be consistent, but your job's going to change. So if you're used to a sick role with your patient's family, getting out of that is hard. And we had that in my family. So
you were saying that you're used to a sick role in your family. Can you touch on that?
Yeah. So when I was in college, Actually, when I was in high school, I found out that my mother was very, very sick. She had liver failure due to an autoimmune disorder called primary biliary cirrhosis.
Oh, wow.
And this one's a bitch because your liver eats itself from inside out, basically. It's autoimmune. So it's fun when you have liver failure and everybody's like, oh, were you a drinker?
Yeah.
She's
They automatically assume.
And she hated drinking. Although I'm going to tell you, she had margaritas at least once a week after she found out she was in liver failure. She's like, what? Why not?
Yeah.
So she found out about it when I was in or she knew about it for a long time, but it started to really get ugly when I was in high school.
Got it.
And she became chronically ill, and she was sick for 5 years before she ultimately died. And she died when I was a sophomore, I think.
So is there no way to get a transplant for that? Or do you get a transplant?
There is. What sucks about primary biliary cirrhosis is the way that it attacks your liver doesn't go the way a lot of the scoring systems go. And there's been a couple of scoring systems. There was a different one when she was sick. There's a new one now called the MELD. What's interesting about it is it looks at whether you can clot, whether you have lesions, stuff like that.
Okay.
And primary biliary cirrhosis doesn't play that way. It's
it has its
really
own
chronic
thing.
and then you're done.
Got it.
And so even in practice, in transplant, working as a transplant nurse, I saw patients who the only reason they got transplanted was because somebody actually that they knew, one or two people removed, direct donor to them. So they knew someone that had died who said, I want my liver to be given to this person. I saw that twice.
Well, this had to lead into your role as being a nurse.
I think it did.
Did you play that role in your family?
No. My mom wouldn't let me. She really wanted me to make sure I went to school, got a life, etc. So the women in my family, like her mother and sister, handled her. She was a pretty fierce lady, so she handled it as well.
Right.
And then my dad just kept working and keeping the insurance going. That was his job, was just to make sure we had the bills paid.
And those stories, ring so true.
Mm-hmm.
I had I played the caretaker a little bit in my family as well.
Yeah.
And it's funny sometimes how you reenact those things in your family as the areas of medicine that you go into, or there's that one little thing that happened in your life.
Yeah.
Yeah.
And what's crazy about it is, I've had friends who are like, oh, your mom died of liver failure, you're a transplant nurse. And I was like, what's really nuts is I really wanted to be I really wanted to go into the sexual assault nurse examiner, nursing forensics. That wasn't why. I ended up having really fascinating transplant patients in my rotations back in Connecticut. There was a guy who was highlighter yellow, really sick alcoholic. Just his family finally was talking to him again because he was going to die. There was a woman who'd had a kidney transplant where it wasn't going well, chronically not going well.
Right.
And they were just fascinating.
Yeah.
And that's what made me look into transplant. My mom was sort of an afterthought as to why I was interested in it.
Right.
It was definitely there. I'd be crazy to say it wasn't.
Sometimes it's subconscious, though.
Yeah. And I totally believe that.
Yeah, absolutely. Because, my father died of a heart attack.
Yeah.
Guess where I went into?
Cardiac. You went to cardiac nursing.
I did. I remember the first time doing compressions on someone.
Oh, gosh. And then and that's the other thing is when do you let in what you saw with your family member?
Yeah. Honestly, it definitely plays true because healthcare is my second career. It wasn't my original. Yeah.
Mm-hmm.
So, there was a part of me, but I totally get the idea, understand how people gravitate towards certain areas.
Yeah.
Because of something that happened when they were younger.
Yeah. And it's you just want, and for me, the two nurses that took really, really excellent care of my mother and one person who took care of me when I was in college, just as a normal, healthy college student, my NP at school, they showed me that nursing wasn't a handmaiden's tale. There was a lot of independence and autonomy in how they took care of my mother. And my aunt used to be basically an off the books, not a doula, but a midwife. She was not a real midwife, but she delivered some babies back in the hippie days in San Francisco.
The table a little bit, right?
Yeah. It's bartering for babies.
Yeah, I get
it. And so I had nurses in my family, but most of them were actually not internal. They were external people that just were there and present.
So now I like to go into a little different topic. I always ask some of my guests. Everybody wants to hear some gross medical stories.
Totally.
And you had one involving, shit.
Yeah.
Let's be real.
Because everybody does, right?
This is like nursing foreplay. I want to hear your shit story.
I know.
Yeah.
Hey, babe, let me tell you a story.
Yeah.
So, do you have nursing students that listen to your podcast that you know about?
I've reached out. Yeah.
So when I was in nursing school, remember, I'd gone into it, my mother had died. So I had this heart soul connection. Yeah. I was surrounded by really dope nurses. I had no other options because I had burned out of the medical pathway. And so I'm in clinical. I'm a slow ass learner.
Yeah.
Like, it's funny that I'm in education because I am a slow clinical learner, and I'm taking care of this older woman, and she drops, a deuce for me, as they do.
Like in the pot?
Yeah,
or
in a good old fashioned hat. Like,
okay.
she did it all right. She didn't fall. Like, I was winning.
Right.
And I went in the bathroom to like handle it.
Yeah.
And I had it. Like, it was a normal, healthy, humongous adult shit.
Right. You're
formed, to some people, a beautiful stool, like a dream.
Right.
For me, I was like, what the fuck am I doing with my life?
Just a normal human stool is what did
it nearly broke me. Like, I was just like, I remembered that day. I gagged for a smooth 4 minutes, 5 minutes.
So
like,
how do you deal with yourself daily? I mean, or every other 2 to 3 days, depending on
well, no, and it's like, if my girlfriend heard this, she'd be like, I am not surprised. Yeah. But like, I just, I've learned since that it was the healthy part, like the normalness of it, that was just disgusting. Because normal shit's just gross.
Right.
Sick shit's more interesting. So, because liver kidney transplant, if you know anything, like, poop is like our world.
Lactulose
we
central.
give lactulose like it's a gift from the gods. So,
you know what flexi seals are, right?
Oh, dude. I would have invented them if I had time.
Right.
Yeah. No, they're everything. Like lactulose enema. Want one? I can do it. But like that healthy human shit nearly ended my career in nursing. I was
normally,
like,
I was expecting a gross story, and you're talking about normal.
No, I've got a grosser one. But like, that was the one that I went home. I wrote my journal about it because nursing school you have to journal.
Well, let's dig a little deeper. I want to hear the grosser.
The grosser one is more. It's not about me in healthcare.
Yeah.
It's about what happens in a hospital in a city.
Okay.
So at our hospital, like, again, I work nights and days. So I come in on day shift, and I walk down the hall, and the reason these two are linked, because I was reminded of my little old lady's healthy stool. I was like, it smells like healthy human shit on our floor. And it never does. Like, even with borders, we get lucky. We get the borders that are messed up. So I'm walking in.
It smells like healthy human shit.
I said it out loud. And it's like 6 o'clock or 6:30 when I'm getting there. And I'm like, what is going on?
Yeah.
And we go to the desk. And back in that day, we used to do taped report. And what I found out, I got there before people started taping report.
Yeah.
And they went into tape report, and one of the 2 report rooms was smeared. Somebody had come in the night before, during the night, walked in. He'd used the commodes that were stored in that room, the clean ones.
Okay.
And he'd also just defecated everywhere and just smeared it all over the walls.
With his hands?
In our report room.
With
I'm guessing with his hands. There weren't any dirty gloves in the room. And then had left.
Oh my God. I hope that was a patient.
Oh, it had to have been a homeless person. I was like, it totally gives away that we don't have a lot of cameras in our hospital. At least we didn't 10 years ago. And so the entire room was just like a hazmat zone. Like,
oh my
so we had to do like live report, which had everybody completely melting down because they hadn't done it in years. And it was healthy human shit. Otherwise, people had ignored it. They didn't realize that it wasn't just a patient on the floor. Yeah. Until report time. Like, because it had started apparently smelling hours before.
See, I like, and it's sad. It's sad for and that's a sad situation. But what I'm leading into is that it's sad sometimes with the finger painters. You know what I'm talking about? Yeah. Woo! They're confused, and it's like, it's like, oh man, don't touch me, bud. Don't touch me. Yeah.
And then that reminds me of the other guy. We had a guy who, he was a sick liver, and he was kind of a mess.
Yeah.
And we'd finally gotten him to use his urinal rather than just pee in bed.
Yeah.
And so this was like a night, and then middle of the night, I'm in charge. So I'm close to his room, and I can hear what sounds like a water leak. And what he had done, instead of using the urinal that was like about 2 inches away from him, he had just turned flat on his back, held his penis, and then just peed.
Like an arc into it?
A beautiful arc right onto the floor at the tail of his bed. He'd missed all of his linens. His bed was clean.
I was hoping you would say that he was peeing into his urinal. Like,
no.
that
was something we had all hoped. We were like, hey, so
that'd be even more funny.
Had you just turned yourself this way?
Like nothing but net. Look at this.
You would have hit it. But and I was like, do you know what you just did? And he was like, yeah. I didn't get it in the bed now, did I?
Right.
And I was like, God, liver failure is fascinating.
Yeah.
They're like shisty and funny and a pain in the ass.
So you ever seen like a shit that came out of somewhere, you're like, how in the hell did it come out of that?
I told you, transplant, like that's one of our main assessment techniques is what does the shit look
you were
like?
Talking about like normal
what does
shit.
It smell like? So this poor guy, he was in liver failure. So anyone that's out there that knows what liver failure looks like, one of the things that we do is we give them a medication that makes them just basically shit rivers. And it sucks, but it keeps their brain from going totally toxic, swelling, etc. It's called lactulose. It's really amazing stuff. And so this one guy I had, he was a really big dude. He was probably 300 to 400 pounds, not in any kind of shape for a transplant. super obese, and he was like showing signs of being backed up. But again, like you're never
Like
backed up.
Well, how backed up?
Like
what signs was he?
He was
like,
a big dude, so we couldn't tell if his belly was round from being
okay.
big, or if it. And so like it was getting a little firmer and firmer. But he'd been pooping the whole time. Like he'd had liquid stool the whole time. Like, and that's a thing.
So was he like progressing in pregnancy? Kind of was he like 3 to 9 months?
Like it was getting more tympanic, a little bit more round and hard, and all that stuff. And so this had started maybe this shift before me, where we were just trying to figure out like how is it that he's still having like those loose liquidy stools that we're used to.
Not the shit before you, but the shift before you.
The shift before me.
I
got a diction. And so like when I had him, the doctors finally were like, he must be backed up. This must be a small bowel obstruction. It was hard to visualize on x-ray, blah, blah, blah. So I start giving him suppositories, which I've like never given to somebody who's taking lactulose.
Yeah,
start doing
that doesn't make sense.
And he's got one of those awesome bariatric commodes because he's such a wide dude.
Yeah, he's a big guy.
And he gets up and he sits on it, and he sits on it for like an hour, which will give you pressure ulcers, which will give you like it's the worst thing to do.
It gives you that little donut around your butt cheeks.
He refused to get up.
That little hole that goes in the commode.
Seriously.
To get up, and sometimes it leaves a ring.
It does. He refused to get up. He was like, "No, I'm going to get this out of me." And when he finally got up and went back to bed, what he left me was a gallon, perhaps, of just the largest. I thought it was an elephant shit. I was I looked at it, and because
sometimes the sheer size of it coming out solid. Like this guy sounds like it's probably loose, right?
No, it was like mostly solid with some softness.
Like it's so,
but it wasn't hard solid. It was just like mostly solid with some soft. But I was like, you were back. We just saved your life.
Yeah,
like
exactly.
It was like he had an elephant. My girlfriend accuses me of seeing what I want to see initially, and what I saw, and my head actually was like, did an elephant come in here and take a shit in his commode? And I was like, no, Lindsay, reality. That man just took an elephant dump in his commode.
I think every nurse has that, like those 3 shits in their career that they remember.
That's,
you know what I mean? That's the one for you.
That was my Titanic. It was so big and so insane. And I looked at him and I was like, you feel better? And he was like asleep like a baby. He was just so...
Yeah, hell yeah. He just gave away the Titanic. I'll be sleeping too.
Unbelievable. Thank God it was a bariatric commode, because if it was a standard size one, like it would have... I'm telling you, I think it might have actually filled it all the way up. I was serious. Never seen anything like it.
Yeah, you didn't forget about it.
And I never will forget about it. On my deathbed. And that elephant shit. Having a toxic brain makes you really special.
So, Lindsay, thank you for coming to the show today.
Derek. Thank you.
You're an awesome guest. You're welcome back anytime. Thanks for being here at NSR today.
I had a lot of fun. Thank you.
All right, thank you.
Thank you so much for listening to NSR, National Scrubs Radio, with your host, Derek J. For more great content and to stay up to date, visit Facebook and Twitter at Nat Scrubs Radio. We'll catch you next time.